Secretary Sebelius, thank you for joining us this morning. And in recognition of your ongoing dedication to improving health care for all Americans, we have a special resolution that we'd like to present to you. Now, on behalf of the HIMSS Board of Directors, I have this resolution which reads, whereas the 1999 Institute of Medicine report to Err is Human reported that 44,000 to 98,000 U.S. residents die annually from medical errors, and whereas the inclusion of health information technology in nationwide efforts to improve quality and safety has been a bipartisan and cross-governmental initiative recognized by 7 consecutive sessions of Congress, 3 consecutive presidents, and multiple federal agencies who have all committed to applying health IT solutions to simultaneously improve outcomes of care and address the rising costs of care delivery. And whereas in 2009, President Barack Obama signed the American Recovery and Reinvestment Act into law, providing historic investment in health IT, including funding incentives for adopting electronic health records that will help to reduce costs and improve quality while ensuring patients' privacy. And whereas Kathleen Sebelius, the Secretary of Health and Human Services, and her department have worked tirelessly to implement key regulations designed to transform healthcare using IT. Therefore, be it resolved by the authority vested in its Board of Directors by the more than 35,000 individual members, 500 corporate members, and 120 affiliate not-for-profit organizational members, HIMSS endorses the congressional mandate providing critical funding to realize the widespread adoption and meaningful use of health IT in order to improve patient care, save lives, and transform health care into a more effective delivery system.
Thank you for that nice introduction. It's great to be with you today. I want to really start by thanking all of you here for the incredible work you're doing to improve health care for people across this country. From those of you who are here as engineers designing the health information technologies of the future to the health professionals who are employing them in hospitals and doctors' offices and nursing stations and health centers across the country, the energy and creativity and commitment to improving health in this room are a very positive sign for the future of healthcare in America. And I also want to congratulate HIMSS on a 50th anniversary. Now, for many organizations, that's an entire lifetime. But when it comes to health IT, I think you all will agree we are just getting started. Over the last few decades, we've seen information technology transform industry after industry in this country. We've watched 24-hour ATMs replace bankers' hours and credit cards revolutionize retail. We've seen online shopping surge, social networking become a way of life, and in many cases, forgotten how we ever lived or worked without our smartphones. Now, for Americans, these transformations have brought huge benefits: better service, more convenience, lower costs. And for our economy, these transformations have meant countless new jobs. The top 5 internet companies today are all American. Over the last 10 years, yes, that's very good news. And over the last 10 years, their workforces have grown nearly 600%. Now today, we are poised for a similar revolution in healthcare. When President Obama came into office, here was the snapshot of what healthcare looked like. Only 2 in 10 doctors across America and 1 in 10 hospitals even used a basic electronic health record system. Pretty low number. But over the past 2 years, the share of primary care providers using a basic electronic health record has gone from 20% to 30%, a 10% increase just in that 2-year period of time. And when doctors and hospitals were recently asked whether they plan to apply for the brand new incentive payments that will require them to be meaningful users of electronic health records by 2015, 4 out of 5 hospitals said yes, and 2 out of 5 physician-based offices said yes. Now, if those numbers hold, this would be the fastest growing health technology that we've ever seen in this country or any other country around the globe. And it's being made possible because the industry, the healthcare community, and the government are all working together. Now, it's taken innovators like you in this room developing better products that are more powerful and easier to use. It's taken healthcare providers who are showing how this technology can be used to improve care, to cut paperwork, to lower costs, and most importantly, to track quality outcomes. And it's taken state and community leaders across the country who are making it easier for providers to share health information electronically with the full protections of privacy in order to deliver better care for patients. It took an historic piece of legislation passed by Congress and signed by the President 2 years ago last week. So in the last 24 months, the Hitech Act has taken a battering ram to many of the obstacles that were preventing health information technology from spreading across the country. Whether it's been the creation of the 62 health IT regional extension centers to help small practices and critical care hospitals set up their health IT systems, or investing in health information exchanges, or supporting the Beacon community projects that can be models for the rest of the country. The Hitech Act has made it easier than ever to start using an electronic health record. And providing the bonus payments, which started rolling out the door in January for hospitals and eligible providers that adopt electronic health records and use them to improve patient care, the Act has made it more affordable than ever. So over the last 2 years, we've created unprecedented momentum behind health information technology. Now, I know that some of you may be wondering how that momentum will be affected by last fall's elections. And I think you can answer that question by looking at a list of who's spoken at the HIMSS conference in the past. You've had Senator John Thune and former Speaker Newt Gingrich, former President George W. Bush, all of whom are Republicans. You've had Majority Leader Nancy Pelosi and Senator Tom Udall and Secretary of State Hillary Clinton, all Democrats. Now, while they might not seem to have much in common, they all came here to talk about why electronic health records are critical to our country's future. So while there are lots of disagreements, in case you haven't noticed, in Congress on health issues, health IT is one of those areas where both parties stand together. And today, I can tell you that this administration stands with them, from President Obama down through our entire group of leaders. We believe in health information technology because it's an investment in a stronger economy. And as the President has said, to win the future, America must out-innovate the world in the 20th century, just as we did in the 20th. Now, America has always been a country of trailblazers. And today, health IT is one of our most promising new frontiers. And you all know that, which is why you're here today. To see its huge job creating potential, just look at the 231 companies that have had a health IT product certified. Of these companies, nearly 2/3 have fewer than 50 employees. Any one of them might be the next Google or Microsoft. Now, earlier this morning, I got to have breakfast with the CEOs of about 15 of these small entrepreneurial companies. And the work they're doing is incredibly exciting. Every day they're finding new ways to make doctors and nurses better at what they do and give patients more control over their own health care. Now, there's no doubt we are in a very tough budget environment. And that's why President Obama has proposed a budget that will reduce the deficit by $400 billion over the next decade, bringing domestic spending down to the lowest share of our economy since the days when Dwight Eisenhower was president. But as important as it is to make cuts where we can, it's equally important to keep the investments that will keep our economy growing. Just as businesses don't zero out their R&D budgets when earnings fall, and families don't raid their college savings account at the first sign of an economic slump, we can't afford to throw away the investments that will actually help secure our future. And that's why even as our 2012 budget makes significant cuts, it also calls for an increase of over 25% in the budget of the Office of the National Coordinator for Health Information Technology. But our commitment to health IT is more than just about creating jobs for the future. It's also fundamentally about improving America's health. Now, America has the best doctors and nurses in the world. Our hospitals offer the most advanced treatments. We devote more resources to health than any country by far. And yet, because of the breakdowns in our delivery system, Americans continue to live sicker and die younger than many of our peers and competitors around the world. Now, part of the problem is that when Americans walk into a hospital or a doctor's office, we often fail to get the right care. Every year, we have 2 million Americans who develop a healthcare-associated infection. Not the disease or illness that you bring to the hospital, but what happens once you get to the hospital. And at the same time, it's estimated that close to a third of our healthcare spending, about $700 billion a year, goes to pay for services that may not improve anyone's health. So the health law that President Obama signed last March, the Affordable Care Act, starts to address these challenges. For example, it contains a series of reforms that change the way we pay for care to reward quality and not just the quantity of what we do. And the law supports new models like medical homes, in which healthcare providers can work together to help patients manage their chronic conditions. Electronic health records, which passed the year before we had the Affordable Care Act, are critical to these efforts and support that critical platform. They can let providers know that a patient has already received a test so they don't have to have it done twice. They can remind surgeons of a simple follow-up task like ordering lab tests or antibiotics that can significantly reduce the chance of complications. And they can help teams of doctors, nurses, nutritionists, counselors help to coordinate a chronically ill patient's care. Electronic health records can empower patients, allowing them to access their own health information without having to call up 5 different doctors' offices. And across the country, hospitals and health professionals are showing how electronic health records can lead to improved care. Now, earlier this year, I had the chance to be in Cincinnati and visit the neonatal ward at Cincinnati Children's Hospital, where they're performing some of the most difficult surgeries anywhere in the country and maybe anywhere in the world. In that ward, they had gone 1,000 days without any serious safety incident, a record they credited directly to their use of health IT, every person, every step along the way. Now, in the long term, electronic health records will also make it much easier to gather the data that allow us to measure and improve health outcomes. For example, the information stored in millions of electronic records around the country can help us quickly and cheaply compare treatments to see what works best. And those same records connected together can help spread the knowledge at the speed of light throughout our healthcare system. So in the Obama administration, we look at health IT not just as an opportunity to grow our economy, but also as a powerful tool to improve the health of our nation. And that's why we'll keep working to support these technologies in the years to come. But we also need your help. First, we need you to be a part of the conversation about improving overall health care in America. Health reform needs health IT, but frankly, health IT also needs health reform. Ultimately, the market for electronic health records will be determined by how useful they are to clinicians and hospitals. And that, frankly, depends on the success of our reform efforts. If healthcare providers are rewarded for delivering higher quality care, they'll be more interested in technologies that help them measure and improve that quality. If there are incentives in place to avoid medical errors, a health record that can help prevent those errors becomes much more valuable. So if we want health electronic records to spread, we need you to be more than advocates for the technology. We need you to be advocates for the kind of healthcare system that allows this technology to make its biggest impact. Another area where we need your help is reaching out to the 70% of America's doctors and nurses that belong to small practices. Now, we know that switching from paper to electronic records is never easy, but it's a lot harder if you're in a small practice with a limited staff and resources than it often is for a major hospital with a well-trained IT team and a big budget for capital improvements. So we in the federal government are working hard to reach small providers, especially through our regional extension centers now operating across the country. But you in the industry can play a key role, whether it's offering financing options to reduce the upfront cost or providing better follow-up or support after you make a sale of a product. We already have a gap in health IT in this country, with the average large urban hospital way ahead of the average small rural practice. But if we want all Americans to enjoy the benefits of electronic health records, we need to work harder to close that gap. Finally, we need to make sure that the adoption of health IT doesn't contribute to another gap in our health system. The ongoing racial, geographic, and socioeconomic disparities in care that unfortunately are all too common still in this country. We need for vendors to develop, sell, and support products that clinicians who serve our most vulnerable population can afford and can put to use. It's unacceptable to have this powerful new health tool and use it to serve some Americans better than others. So here at HIMSS, we get a glimpse of the future in which electronic health records are fully integrated into our healthcare system. We could have ambulances equipped with handheld computers that EMTs use to update a health record that ER clinicians can read even before the patient arrives. We can have mobile applications that remind patients to take their medicines, to check their blood sugar, or get preventive tests, and then send that update right back to a doctor or nurse's computer. Now today, some of these possibilities seem far away, but I feel confident that someday these will be absolutely common features of the healthcare system. Eventually, we'll see hospital after hospital clear out their file cabinets. There will be some new generation of Americans that won't understand when people joke about doctors' handwriting. It will be a thing of the past. Yes, and that will be good news. Now, the question that remains is how long will we have to wait to enjoy the benefits of this technology? And will those technologies be developed and built here in the US or overseas? I think the answers to those questions will be determined by how we take advantage of the opportunity that we have, the platform that we have, and how aggressively we pursue it in the coming years. I believe that if we build on the partnership that we've established in the last 48 months, and if we push forward in the areas that I've identified, that we can make more progress on health IT in a nation in the next 5 years than we have in the last 50. That would be an extraordinary technological achievement. But more importantly, it would be a giant step toward a healthy, more prosperous future for all Americans. So in the months to come, I hope you'll continue to work with us to accelerate the development of a national health IT network that will mean better tools for healthcare providers, for doctors and nurses, better care for patients, more control for consumers, and new jobs for our economy. We've come this far together, and now we need to finish this very important job. Now, as I said earlier, we wouldn't be here today without the combined efforts of the healthcare providers, of industry, and of government at every level. And even within the federal government, we have many people who are working in this important space. But if I had to pick one person who's the most responsible for the transformation that's underway, there's no question it would be our National Coordinator for Health Information Technology, Dr. David Blumenthal. As some of you know, Dr. Blumenthal will be leaving our department soon, and we are so very sorry to see him go. Unfortunately, he has students and patients and family who continue to miss him in Boston. But we're incredibly grateful for his work over the last 2 years in guiding our health information technology efforts, and as I say to him, as building an enterprise out of what was nothing. David has always made sure we were guided by a doctor's perspective, both in terms of understanding the real challenges for providers and in keeping us focused on the ultimate goal, which is improving health care. I think the record of what he's accomplished over the last 2 years speaks for itself. What we've undertaken in this time that he's been with us is something that's never been tried before, not only in the United States, but nowhere on the globe. And David is not only departing at a time of unprecedented momentum for health information technology, but he's also leaving behind a terrific team and strong partnerships that help us maintain this momentum. So while President Obama and I remain committed to the policies and directions that David's team will put in place, we also will miss him greatly. And it's now my pleasure to introduce our National Coordinator for Health Information Technology, Dr. David Blumenthal.